what their diagnosis is. So we are many times we give a confirm the diagnosis of malignancy, or on occasions we also give some good news. But what happens next after I write the diagnosis or a pathologist writes the diagnosis will change your life. Not only a patient, the entire family gets affected. It's not just an individual patient, but the entire family gets involved, and the life is changed forever from that point once we confirm as pathologists that there is a malignancy, one, and second, what type of malignancy it is, and third, where and how far it has spread in the body. So these are the vital decisions we make behind the scenes when you are meeting your clinicians and they are telling you there is a lesion and it needs to be validated or it has to be confirmed by pathology. So this is a crucial juncture where the patient, without seeing a doctor, the decisions are made for the patient. So the confirmation comes from a pathologist that you have a malignancy and you have a lesion and it's probably malignant, and next day we confirm. So a good select number of patients can be chosen by a very experienced clinicians as well as the radiologists who identify and make our lives easier so that we can completely hone in on the points that are discussed with us behind the scenes. So it also matters that the experience of the person doing the biopsy procedures and giving us the sample. We are just observing what is given to us. What is not given to us, we will never know. So that is why when a pathologist makes a diagnosis, it is a very big responsibility on the shoulders of the pathologist. As I said, whatever has happened till then is just a suspicion. But when a pathologist confirms it is malignancy and it has to be dealt with as early as possible with the various stagings or various treatment protocols. So as a pathologist, when you see a patient, when the patient sees us and our reports, a lot hangs in balance. What treatment has to be given? Whether we will go for surgery, whether you go for chemo, all decisions are made on a single pathology report. So we have to do it with a lot of care, but in a good number of patients or a good selected, well-selected patients, a diagnosis next day is possible, taking away the anxiety and paving the road next for what treatment has to happen. So my role as a pathologist, or we as pathologists, behind the scenes, we work very closely with the clinical doctors and subsequently also once it is diagnosed, or if you go for chemo first and come back to us, we look and see how much of tumor remains behind and how much needs to be additionally therapy needs to be given. So all key decisions about a patient and the malignancy diagnosis surrounding them are made by the pathologist. And I can confidently say that we have been doing this for so many years, and as Dr. Mukta mentioned, it is a teamwork. You need to have a good team who does the imaging well, who sees the patient in all diligence, and then it comes to us. With that information, our life has become a little bit easier to make a diagnosis and help you all as a patient so that we can take it from there to the next level. So with good selection, with good imaging, with a good radiologist, with a good clinicians, we can deliver a diagnosis at the earliest, most likely within a day or so we can. The next day a diagnosis can be rendered. Okay? So this is my role as a pathologist, and we as pathologists, what we do in the realm of an oncology sphere. Thank you.
Thank you, ma'am, for emphasizing the significance of accurate diagnosis. Your insights are invaluable. Now, allow me to introduce Dr. Sapna Nakia, Director of Breast and Head and Neck within the esteemed Department of Radiation Oncology at Apollo Proton Cancer Center. Dr. Sapna will lead us down the path towards hope and recovery, underscoring the crucial role of timely results. As the saying goes, time is of the essence. The podium is yours, ma'am.
Thank you, Aishwarya. When I started my training 30 years ago in oncology, the treatment of breast cancer was what it is today: surgery, systemic therapy, radiation therapy, and hormone therapy. And yet there has been a huge change in the treatment of breast cancer. One of the things that has changed is, of course, that women themselves are much more aware of the implications of a breast lump, and we don't see as many extremely advanced breast cancer patients as we used to. We still see some, and that is unfortunate, but yes, the number has definitely come down. Since then, there has been an evolution in every aspect of breast cancer treatment. As you learned, breast cancer surgery has become less radical. Breasts are conserved, the axilla is treated in a conservative manner. Chemotherapy has become personalized. We now know there are various types of breast cancer, and the treatment of each of them is different. It may involve using targeted therapies. It may involve doing genetic tests to see whether someone will benefit from chemotherapy. Radiation has changed, and I'm really happy to discuss with you that we have two special types of treatment for breast radiotherapy at the Apollo Proton Cancer Center. One is deep inspiratory breath hold to reduce cardiac toxicity of treatment, and proton therapy, which reduces the cardiac toxicity and the risk of having second cancers, even much more than deep inspiratory breath hold. The other thing that has changed is the patient advocacy. For example, we have the Apollo Proton Cancer Diaries, Apollo Breast Cancer Diaries, ABCD, which is basically a patient survivor group where they can advocate what they need. There is attention to fertility, there is attention to lymphedema, there is attention to the psychological issues that affect breast cancer patients. So there is an all-round approach, and which is why the breast cancer management team, you see most of us sitting on the podium, but I would like to acknowledge our medical oncology colleagues who are sitting in the audience, Dr. Prasad, Dr. Suresh from Banagram, who also comprise, this is the team that treats patients, the surgeons, the radiation oncologists, medical oncologists, pathologists, radiologists, together form the breast cancer management team in various Apollo hospitals in the city. So when all this has changed, what has not changed for the breast cancer patient? What has not changed is the fear she encounters when she first notices a breast lump. And that is why time is of essence. And that is the relevance of this particular program that we are launching today, which is called the Breast Cancer Diagnosis Program, which is the fastest, precise breast cancer diagnosis program. What does it do? It aims to allow a patient to undergo a breast examination, a radiology investigation, a biopsy, and a diagnosis within as much as 24 hours to know that whether the lump that she has is cancerous or not. So the fear factor is taken care of, the emotional issues associated with having a breast lump or worrying about the diagnosis of breast lump is taken care of. But it's not only about fear, and it's not only about the emotional issues, it's also a very practical requirement for a working person, for a person who's traveling from another city, for a person who's traveling from another country, to cut down the time that it takes to diagnose the breast cancer is of a sense of a very important part of being able to deliver quality care. And not to forget that in certain systems, this whole process of seeing the doctor, then getting a mammography appointment, then getting a biopsy appointment, and then getting the biopsy result can actually stretch into a few weeks and negatively impact the outcome of the treatment. So that is the other ancillary advantage, or not really the ancillary, but one of the main advantages of this precise diagnosis program. So my request to the gentlemen and the ladies from the media who are here is to spread the message of this precise cancer diagnosis program, which aims to streamline systems so that the time from noting a breast lump to knowing whether it is cancerous or not is cut down as far as feasible. Thank you very much for your attention.
message of hope and importance of timely results resonates with us. Thank you for your inspiring words, ma'am. A moment of pride, Apollo Cancer Center's doctors have united in the battle against breast cancer. I invite our dignitaries for a photo op. I would also like to invite Dr. Swati Vasan to join the photo op. I would also like to invite Dr. Prasad and Dr. Suresh to join. I would also like to invite Dr. Shiv Shankari.
Okay, ma'am, ready? Ma'am, can you just lightly spread this way, ma'am?
വിജയ് വെറും പൊമ്പിളില്ല ഇത് കുഴപ്പമില്ല Let us go this side. വിജയ്
Okay, ma'am, ready to go? Ma'am, look straight out here, ma'am. Okay, ready? Look here, please, ma'am. All of you ready? Come on, smart. Please wait, sir. One more.
One more. Dr. Gautam will also join.
Okay, one more picture. Are you ready, ma'am? Right?
this side அப்பா பொம்பளைங்க மட்டும்
We'll take two. Ma'am, you can do it when like that. Okay, fine, ma'am. Ready? Ma'am, all of you look straight. Ready? Please wait, sir. One more. All of you come on, smile, please, ma'am. Ready, sir? I'm sorry, look straight, ma'am. Please wait, please wait. Ma'am, abhi solreenga, ma'am.
Doctor, come. Little this side, please. I want the others, the women at the back. It's okay if there's space. That's okay. Dr. Swati, she can move it. Yes, yes.
Smile, all of you, ma'am. Ready, sir? Ready, ma'am? One more.
முடிச்சிட்டீங்கன்னா வீடியோ எடுக்கணும் விஜய் வீடியோ
வீடியோவாக ஸ்பேஸ் கொடுக்குறது தான் அங்கே தான் நீங்கள் நிற்கிறீங்க
நான் எங்கே இருக்கிறேன் ஹவ் யூ லேட்டாக வந்தாலும் லேட்டஸ்ட்டாக வந்துருக்கேன்
ஐ ஆல்ரெடி
நான் பார்க்குறேன்
ரெடிங்களா?
ஏய் வீடியோ முடிச்சிட்டீங்களா
ஓகே இது ஜாயின்
இஸ் a video over?
எஸ் சார்
Look your feet, ma'am. Sorry.